My name is Elizabeth Renzetti, and I'm a journalist with the Globe and Mail, a columnist and a feature writer. And today we have four excellent, distinguished researchers with us to talk about this crisis from different points of view. And I think we can all agree that it is a crisis, and it has been called a shadow pandemic by the United Nations. So while data, is still not obviously fully in, and we won't know for a long time what the actual, empirical effects are, we have all kinds of evidence so far about the rise in gender-based violence during the pandemic. We have, for example, increased calls to women's shelters. We have reports from frontline workers of more and extreme violence being carried out against victims. In the workplace, we see sort of traditionally gendered workplaces, nursing, personal support workers being subject to violence, which they have been all along and for many years, and that continues. We see, for example, a spike in hate crimes against racialized communities, which often have a gender-based component. And we see, for example, that certain communities, especially marginalized women, talk about how their fear of violence has increased and is one of actually the most detrimental effects of this pandemic. So we'll be talking about all of that in the next hour. And I would encourage you to submit your questions. We'll be taking questions during the panel. I'll be asking questions, but also you're encouraged to ask questions, which I will put to our panelists who I'm about to introduce to you. I'm going to start with Chris Mackey. Chris is an activist scholar specializing in mixed methods, community-based participatory research. They currently work as the research and policy manager at Women's Shelters Canada, a national network of violence against women's shelters based in Ottawa. Dr. Patricia Ocampo is an international leader in social epidemiology and Tier 1 Canada Research Chair in Population Health Intervention Research. Dr. Ocampo's unique scientific contributions place her at the forefront of her field, the pursuit of theoretical and methodological innovations in social epidemiology. As an innovator, she has advanced methodologies and generated strong evidence to inform the design of solutions to reduce urban health inequities. Next, we have Vicky Smallman. Vicky is the National Director for Human Rights at the Canadian Labour Congress, and she is an expert on gender equality, women's rights, and gender-based violence in the world of work. And finally, we have Dr. Lise Gottel, who is currently the Landrex Distinguished Professor in Women and Gender Studies at the University of Alberta. And she has published widely in the area of gender, sexuality, and law, including works on charter equality litigation, obscenity law, and sexual orientation jurisprudence. Much of her recent research concerns the legal regulation of sexual violence. And her work has been cited in law reform initiatives in Australia, New Zealand, England, Wales, and Scotland, as well as by the Supreme Court of Canada. A strong believer in public intellectualism. Wonderful to hear. Professor Gottel is the winner of the 2021 Community Scholar Award, and she served as national chair of the Women's Legal Education and Action Fund, as well as on Edmonton's Safe Cities Collaboration Committee. So welcome to all of our distinguished panelists. Thank you so much for joining us this afternoon, and to our audience members as well. So we're going to start a little bit by talking to everyone about where the current research in their field points, what kind of cracks have been exposed during this pandemic, and what is the way forward. So why don't we start with each one of you talking about what in your particular field you have seen is the effect of the pandemic on gender-based violence. And Chris, would you like to start?
Sure. Thanks so much, Elizabeth, for your your wonderful introductions of all of us. I'm really thrilled to be here today with so many wonderful activists and researchers, and to be a participant in this panel. So thank you for moderating and taking care of us while we walk through some of our research that we're up to. As Elizabeth mentioned, I work at Women's Shelters Canada, which is the national network of violence against women and anti-violence shelters. So a lot of what I'll speak to today resonates with the work that's being done in these violence against women shelters across the country. And some of the data I'm drawing on or I'm speaking to is based on some research we did in fall of 2020, which we gathered data from about 266 shelters across the country. We had representation from rural and urban shelters, as well as Indigenous and non-Indigenous shelters. So we had responses from all across the country, every province and territory. So we did feel like this data really was representative of some of what shelters were seeing during the different phases of the pandemic. And what we heard from them is that the demand for shelter and space for survivors of gender-based violence varied during different phases of the pandemic, specifically during lockdowns. So shelters saw some really worrisome trends with a lack of calls to shelters when there was the harshest levels of lockdown. And of course, this varied across the country. But they did see decreases in calls when some of the most severe restrictions were in place. And then once restrictions were lifted, they did see an influx of calls. And in the comment sections of our survey, because we always leave a lot of open-ended comments for folks to be able to explain in more detail what was happening, not just quantitative data, we heard that there was a lot of reluctance to go to the shelters because with more women being more closely monitored by their abusers due to some of the workplace shutdowns during the pandemic. That was a main concern for why women were not reaching out to shelters. It was harder to call and make a phone call to the crisis lines when their abusers might be actually in the home and in their own space. So that was a huge concern, as well as the ideas around contracting COVID, because we know shelters do have some communal spaces where folks gather, such as shared kitchen spaces and play areas for children. So folks were worried about contracting the virus that way as well. So they were hesitant to speak out. And as we know, things were complicated even further with shelters having to actually reduce their capacity because of the public health restrictions. So there was all kinds of different messaging happening. And I think that affected survivors' capacity and knowledge around how to reach out for help during the crisis and during the different waves of lockdown. And some of the really disturbing data we heard in the survey was just that, as Elizabeth already alluded to, many shelters were reporting seeing an increase in women seeking support once restrictions were lifted, and an increase in the severity of cases. So we saw over a third of shelters report a change in the types of violence that are happening. So we saw more physical attacks, including stabbing, strangulation, and broken bones. More forced confinement, sexual violence, emotional and financial abuse, increases in human trafficking. And many of the comments also said overall frequency of abuse in all forms. And many of the respondents to our survey also noted that the perpetrators were using the pandemic itself and the restrictions and the lockdowns as a form of violence against women. So just being able to manipulate them further by giving them misinformation about what was happening or telling them they couldn't leave for various reasons. So they were using the pandemic itself to further abuse and isolate and control women and children, and confining them more to their space, cutting them off from family. It was just a way for abusers to actually gain even more control over these women. So we definitely saw a lot of shelters reporting that in their comments. And some other worrisome trends we saw from rural, remote, and northern shelters, particularly in Indigenous communities, was that women and children were not able to even leave their abusers because their homes, they were in such isolated communities. When we think about flying communities or ice road communities, because of COVID and the restrictions on travel, everything became more complicated. So I know the other panelists have lots of really important insights to share as well. So I'll just end on that, but and pass it over. Thank you.
Patricia, would you like to go next?
Yes, thank you. And I too am pleased to be here with this distinguished panel. Some of the work that I've been focusing on is about solutions. You know, I think research can play a really important role in helping to solve the problem of violence, but I'm not sure that the state of the science on partner violence now is ideal because so much of it is focused on describing the problem. Not that that's not important, it is, but we need a better balance to have some evidence about what solutions are effective. One of the areas that I work in is trying to use technology to help women kind of identify some of the challenges in their relationship and perhaps identify that they are facing harmful situations in their relationship. So many women that we've talked to over the years have said they wish they had known earlier that there were red flags going on. And so we're trying to get them access to screening questions so that they can screen themselves and anytime. And we're using technology to do that. We've created an app so that women can do that, or that app can also be used in service settings to screen, because providers often have either not enough time or they find it challenging to ask screening questions. And we're also using technology to help women do safety planning. But of course, with the pandemic, things changed, as Chris pointed out. There were so many restrictions on how to access services and resources. And so the app that we had created to help women do safety planning, for example, no longer applied. And when we tried to do a rapid literature search, because there have been public health emergencies in the past, to try and determine what might work during a public health emergency, we found very little to no information that was published on what worked in this kind of a setting. So we then turned around and did another rapid project where we asked survivors themselves about the kinds of things that should be done during a lockdown and a public health emergency, or the kinds of things that are typically recommended for women to do and perhaps shouldn't be done now during a pandemic because it might make violence worse, for example, or bring harm. And so we were able to ask survivors and service providers what kind of safety strategies should be used and shouldn't. And then we were able to take that information and put it into a revised safety planning app. You know, so many women, one of the many ways or only ways that they were getting access to help was through technology. And so we felt it was a good strategy to use to try and help women, because they could use the app for free, you know, any time of day or night. And the information that we were able to get out in the new app was appropriate for a public health pandemic. Again, thinking about, you know, research on solutions, we need much more of it. So while we created these apps, there are literally hundreds of apps globally to address partner violence, but really just a handful of them have been evaluated. And so that means we're not necessarily using the interventions that are most effective, because we have no idea whether these apps are effective or not. So it's very important, I think, to not just evaluate apps, but to really think about the kinds of solutions we need that go beyond kind of responding to crises, because that's really what happens with women when they're leaving a relationship, for example, experience a crisis and they need help. And thankfully, shelters and other resources are there. But we really need to move kind of upstream and think about prevention. We need to identify effective interventions for the prevention of partner violence, and not all of them will be about addressing the abuse itself. We know that some of the causes of partner violence have very much to do with the social determinants of health. So we have to do more to prevent poverty so that women aren't dependent on partners that are abusive. We need to do more to address housing precarity, which is really another crisis and epidemic that we're experiencing in this country. And if we could solve those problems, and I realize that they're complex as well, that would go a long way in helping us to prevent partner violence. You know, and these solutions are not going to be simple. And so all the more reason to use research and evidence to guide their implementation so that we can make sure they're functioning optimally and really achieving the goal that they need to. So I would argue that we need far more research to look and focus on solutions. And I'll pass the baton to somebody else now.
Thank you so much. I have so many follow-up questions I want to ask, but I'm just going to save them till we go do one round. So Vicky, perhaps would you like to go next?
Sure. Yeah. I'm happy to sort of build on what the others have said and to shift the focus a little bit to other forms of gender-based violence that people experienced during the pandemic. I mean, intimate partner violence is one aspect, but for us in the labor movement, we have really been keenly reminded of the problem that is gender-based violence in the world of work. And it was a problem that, as you said in your opening remarks, is, long-standing, has always been an area of urgent priority for us. And, the pandemic really shone a light, but it shone like a huge spotlight on some really persistent problems. What we've seen is a real ramping up of third-party violence, violence from clients, customers, patients, anybody in a public-facing job right now has, we've really, seen a lot more stress, a lot more tension that's being taken out on the heroes, that were named at the beginning of the pandemic. And now, especially in healthcare, we're seeing a real ramping up of online harassment and violence, and even threats and suspicious packages and things like that appearing at people's workplaces. And the thing about these public-facing workers in healthcare, in retail, is that they're predominantly women workers, right? So this is a form of gender-based violence that people are experiencing. So third-party violence, and is something that I think that we've not looked at very well. In terms of the employers and unions and governments really thinking through what are the solutions for this. The other area of growth is in online harassment and violence. You see it in journalism, but you see it, in anybody that's working remotely, where maybe they were experiencing harassment at work, and that harassment is now following them in another way, right? In Zoom chats or sliding into their DMs, or, an increase in stalking behavior. We've also, and the labor movement in Canada has for the last number of years really put a lot of emphasis into studying and raising awareness on the impacts of domestic violence at work. Because we know when your home is not safe, the violence doesn't always just stay at home. It follows you to work. And we had a study about 5 years ago that we released that really showed these impacts quite clearly. And we've been working, in our collective bargaining with our partners in the shelter networks, with our union representatives to really find ways to recognize, respond, and address domestic violence at work. But then all of a sudden, the place where for many workers who experience domestic violence, the workplace is a safe space. It's a space away from the relentless abuse. What happens when that space is no longer available and you're back to working at home? And then they also lose that opportunity to intervene and to break the isolation of domestic violence that being at the workplace can be. So all the training that we've done with union representatives and union members to try and help them have caring conversations with people, link them to sources of support, is just that much more difficult, when we're not at a workplace together. So that's been a real challenge for us, not to mention the increased risk of the escalation of behaviors because of the pandemic that Chris described. We've also seen, I think, an increased risk for workers who are already marginalized, right? So racialized workers, the increase in hate crimes, live-in caregivers who are already quite vulnerable to abuse and exploitation because of lockdowns are now, that those opportunities to connect with supports outside of their community are sort of taken away from them. So it's been a real challenge, I think, for workers. And in the union movement, we've been working to better understand gender-based violence at work writ large. We have a new study that we've been working on with our research partners at Western University's Center for Research and Education on Violence Against Women and Children. And we just happened to be conducting this study sort of when this pandemic hit. So we're when the results come out, which should be in January, I'm hoping that we'll also be able to reflect a little bit on the specific impacts of COVID-19. So we have that to look forward to. Unfortunately, I don't have robust data to share with you today, but down the road, we will be able to talk a little bit more. And some of that will be focused on whether interventions have been good or not good. So that solutions-oriented kind of research that Dr. Ocampo talked about is something that we're really keenly interested in as well. Thanks.
Thank you so much. And I think what each one of you is saying is that we have to take a holistic and integrated approach to this issue, because it is, it's for too long existed in silos, and only an organic approach is an all of society approach is going to alleviate this. So Lise, would you like to speak next, please?
Thanks, Liz. And I feel like I'm going to repeat what my co-panelists have already spoken about. My research focuses both on criminal justice responses and also public policy responses to gender-based violence. So, one strategy that I use for investigating gender-based violence is by looking at case law. And it's still too early for us to see the circumstances of the pandemic appearing in the case law, because the cases that have been decided recently are from this events that happened a couple of years ago. With a couple of other people, though, I'm doing a big project where we're looking at the increased prevalence of the rough sex defense. So we are beginning to see a little bit in the beginning of the pandemic appearing in the case law. And I want to echo what Chris has said. There is not only an intensification of gender-based violence, but also the circumstances are becoming more extreme and marked by acts of violence like strangulation. But I also, as I said, look at public policy responses to gender-based violence. And I've recently done a project where I've looked at shifting responses over the past 50 years, marking the 50th anniversary of the Royal Commission on the Status of Women. And I just wanted to say that, we've seen a pattern that has been fairly constant, really, over the past 40 or 50 years, unfortunately, whereby the broad demands of gender-based violence advocates and feminist advocates for social policy responses, for prevention, for stable funding for the NGO sector have been really squeezed into a narrow criminalization approach, which doesn't fix the problem, as we know. And most recently, and I'm sure Chris will talk about this more, we've seen many organizations coming together under the leadership of Women's Shelters Canada to develop the National Action Plan on Gender-Based Violence. This is really important. And we're beginning, I think, to see some receptiveness on the part of the federal government, at least, to this kind of approach that would demand a coordinated federal provincial response, because what we've seen happen in this complicated social problem is that responses have been hampered by federalism. So we really do need a coordinated response that goes beyond a narrow, individualized criminal justice response. And the National Action Plan really lays that out quite perfectly. In fact, I think that it's a kind of a roadmap for a COVID recovery, inclusive COVID recovery.
So maybe just fill in the members of the audience who aren't familiar with the roadmap to the National Action Plan, Gender-Based Violence, which is this, huge undertaking, recommending a 10-year plan involving multiple layers of government and billions of dollars in investment. Where do we stand with that? Where does the federal government stand? Maybe you can just fill us in a little bit, Chris. Thanks.
Thanks, Elizabeth, for that and for everyone's comments. I feel like I don't get enough of a chance to hear from other sectors on what's going on. So this is really helpful for me to hear across our work of what's happening. And I love Dr. Ocampo's note on prevention and moving forward with solutions. And I think that's exactly what we did with the National Action Plan work that we did. So, and I know Vicky had a huge role in that, so I'll give some space to her to also speak to it. But we did bring together, I think it was over 40 experts in gender-based violence and violence against women from across the country to basically develop a report and a list of recommendations for what Dr. Gotel was mentioning in terms of a roadmap on the National Action Plan on Gender-Based Violence and Violence Against Women. And these experts, as I was the lead researcher on the project and had the pleasure of pulling together over 100 recommendations to government to basically give them a starting point on how to start this National Action Plan. And our recommendations were really carefully researched, and we went through previous recommendations from many national reports and academic reports as well. And we also ensured that there was a time frame attached to these recommendations, so they weren't just left hanging in terms of like, do this X, Y, Z, and it'll be fine. But it actually gave some tangible, practical advice on how to move it forward. And we also ensured there was a strong intersectional analysis on how a national action plan must integrate an analysis of systemic gender-based violence, of how systems are reproducing racism and misogyny and sexism, and how these are all compounding and creating very specific forms of violence for different marginalized groups of women and gender diverse people. So we really wanted to look at the gaps in policy as well. So we did a really thorough scan of what policies exist and what we needed to add to that conversation. So these groups worked really hard under a really tight time frame to bring this over 400-page report together. So I really recommend anyone who hasn't had a chance to check out the roadmap to definitely do so. And I think Vicky might have some more insights as she was one of the co-chairs on that work. And so I'll pass it over to Vicky to give some more concrete insight into that process.
Thanks, Chris. Yeah, it was an intense sort of process, and really what we've done is we've laid out a very strong framework, but it's going to require all the governments to get together, to work with experts, to work with civil society, to actually see this come to pass. And we know that the federal government has announced an investment in getting that process underway in the last federal budget. So we'll have to see in the mandate letters that are coming out, how they're intending to follow through. But it really is a sort of a multi-jurisdictional, multi-sectoral initiative if it's really going to be done right. And so the report that we did really did lay out what we thought the process and some of the key recommendations that would need to happen in order to do it right, and what it was going to take. And the group that I worked on social infrastructure and public policy. And so all of those social determinants of health that Dr. Ocampo talked about, the importance of economic security and decent work, the importance of physical and social infrastructure, transportation, housing, childcare, communications technology, all of those things were embedded in the recommendations that we made. So quite comprehensive. And then from the world of work component, the pathway to actually sort of cementing an approach that focuses on prevention, that focuses on how to respond and address violence and harassment in the world of work, gender-based violence and harassment, is really all embedded in International Labor Organization Convention 190, which is an international labor standard that actually establishes the right to a world of work free from violence and harassment harassment. Canada needs to ratify it, and then we need a process that brings governments, employers, and workers together to map out how to actually implement the provisions of the convention.
That's so interesting. And I've noticed this idea of prevention, we keep coming back to it, and solutions. So I wanted to ask Patricia and Lise both a little bit about this. In my own reporting, I constantly come up against this idea that the field of prevention is so under-resourced for a variety of reasons. So I wanted to start by asking you, Patricia, about that app. Sounds fascinating. So what is it called? And what did you hear from survivors who unfortunately are not consulted as much as they should be when policy, I think, is made? So what did you hear from them about what they wanted to see?
Yes, and thank you for saying that survivors are not consulted enough. I think they're not consulted enough when we do our research. So I love hearing about the way in which the National Action Plan was created. Some of the research that's actually coming out, the Pan-Canadian Survey, was very much done in partnership and under the leadership of survivors. And I always try and include survivors in my work because I think they're going to tell us what the answers are, what's going to work for them. And so we need to do more of that kind of research. The apps that we created, there are two of them. One is called With Women, and it's a quick, it's an app that you can complete fairly quickly in about 45 seconds. And there are 9 validated questions that really are asking about unacceptable behaviors that might be happening in a woman's relationship. And you can do it yourself. You can recommend it to a friend. You can do it for your cousin or your sister to see if there are some red flags in the relationship that a woman should be aware of and perhaps investigate further and get some assistance for. We have a companion app. Oh, and we also have encouraged clinicians to use it in healthcare settings. We used it with one of the clinics, a fracture clinic at my hospital, and they got their screening rates up to about 86%, which is actually pretty good because it's so easy to use and providers don't have to ask uncomfortable questions, yet they have the information and they can act on it. In fact, the fracture clinic asked for it because they kept seeing women coming back with fractures over and over again, and they wanted to do something about it. So we have another companion app for a woman who actually does have red flags in her relationship and wants to find out more about what she can do to prepare for what might be down the road. So do some safety planning. And we created this, again, with survivors. We made sure it was plain language. And it is evidence-based. It's based on a model that was tested in randomized trials by other investigators here in North America and abroad to make sure that the app helps women kind of sort through all the hundreds of things that they could possibly do when they safety plan. It really helps them align the plans that they put in place with what's important to them. So maybe housing is an important issue to a woman now. And so you can look at the safety plans related to housing first, for example, because that's important to you now. If things change, you can go back to the app and maybe finances becomes a priority. And so then you can look at some of the strategies that you can use if finances is one of your priorities. So there's a number of different priorities that you can choose. And it helps you identify those strategies that are important to you now. So it helps you to prioritize. So we have one that's specific for the pandemic, and it's called Promise. So promoting safety during an emergency. And the kind of information that we put in there that we heard from women during the rapid research that we did. So we were fortunate enough to get a rapid research grant, which was specific for the COVID-19 pandemic, to ask survivors and service providers about the kinds of things women should or shouldn't be doing. And so, for example, survivors told us that, now is not the time to file for a restraining order, because that could backfire and that could actually make things worse. Some of the other things that they told us not to do, again, just during the pandemic, is sometimes women are told, well, maybe you should hide alcohol or substances that a perpetrator might take, and it might make the violence or abuse worse, or a particular episode worse. But doing that during a pandemic while people are locked down might make the abuse worse. So don't use that kind of a strategy. Another strategy that was not recommended during the pandemic is that so many people were on their devices during the pandemic, and so they were texting or emailing, but switching from phone to email or switching from phone to texting, for example, was not recommended, I guess, because then perhaps the perpetrator could not see what you were doing, and that could potentially make things worse. So there were several things that were mentioned to us that we then quickly shared with other service providers through infographics and through webinars, and then also published that research. And we hope that others will similarly do more research like that, so that we can begin to build a body of evidence about what we should and should not be doing, and supporting and encouraging during times of public health emergencies.
Thank you so much for that. Of course, I was muted. It had to be me who forgot that I was on mute. Lise, would you like to talk a little bit about the prevention piece, the idea of coming at this problem from a more upstream place?
Right. Well, it's not quite what I do, but this is what I do know. And I might shift the focus a little bit to sexual violence prevention. Yeah, and what we do know is that we have been doing this entirely wrong. The research shows us that these one-off consent sessions based upon the miscommunication hypothesis, the idea that sexual violence is really the outcome of a lack of communication. This is entirely the wrong approach, and it doesn't have any effect on rates of sexual violence. And the best research tells us that what we need instead is comprehensive sex education deeply embedded into the primary and secondary curriculum. We do not have this. And in fact, we have in place in Canada several provincial governments, and of course we know education is a provincial responsibility, that would be very, very resistant to this kind of an approach. So what we have then is a political and ideological problem that is preventing us from putting in place the strategies that we know are the best ones to reduce rates of sexual violence.
Elephant in the room. None of what we're talking about can be in any way addressed until we deal with the very deep roots of misogyny and transphobia and patriarchal culture that we all exist with every day. And I don't know, that's a huge question. So maybe I won't just sort of throw that one out there, but it seems like education is so important, starting at an incredibly young age. You hear this always for boys and girls and gender non-conforming people. So but leading from that, I would ask, has the pandemic created more awareness, do we think, or am I being too optimistic about that? Awareness of the different forms that gender-based violence takes, whether it's at the workplace, whether it's sexual, or whether it's financial, cyber stalking, emotional, all of these different things. And I'll throw it open to anybody who wants to answer that. But do we think we have a bit more awareness of that now, or not?
I would say that there's more awareness that gender-based violence is a crisis that we need to address. I think it is getting more attention and it is getting more money, which is all good, but we're also still treating it as a crisis. So we need both the crisis management funds and we need to address the issues related to prevention. You know, in terms of the attitudes that you had mentioned, those are really critical. We need to address those if we're to see change in society. But I think it's more than education, because we really are talking about power structures. So how do we dismantle some of these power structures, which is really getting at these systems issues and systems level oppression, which is helping to maintain those attitudes and helping to maintain these inequities that lead to high rates of gender-based violence. So we really need to deal with the systems issues. Now, you know, there have been things that happened around the time of the pandemic, groups rising up and saying, no, we're not going to tolerate more oppression and discrimination, and let's address systemic racism, for example. So there is more awareness, I think, of some of the systems issues, which feel like permanent barriers to our being able to make progress, including on something like gender-based violence. But we really have to deal with the systems issues, because those are at the root of the causes.
I think also, I think we have to, there is more awareness, but I don't think we've reached the point where we're willing to take on the big work that needs to be done. You know, if we really want to, realize the right to a world work free from violence and harassment, we have to get away from this idea that putting up with violence and harassment at work is just part of some jobs, right? And for many people, like working in healthcare or in education or, women journalists, it's like, well, it's part of the job. So you put yourself out there, you have to, suck it up. But that's not acceptable, right? And the answer is not zero tolerance, go and punish the perpetrators, right? It really we need to focus on understanding the risks, understanding the risk factors, looking at what the vulnerabilities are, looking at prevention, and so on. And that does mean a long game approach. And, it takes a lot of different kind of minds at the table to be able to really figure out what it is we have to do, which is why the National Action Plan is so important and why ratifying C-190 and actually coming up with a plan to implement it is so important, because these are complex issues. But just because it's hard doesn't mean we shouldn't start to do it. And I think that getting out of this world of, like the short-term political mandates is what we need to do, to be able to play the long game and do the work that's necessary to really take on these issues. So, I think that the pandemic leading into when we put our survey out in January, which I think will give us a really good snapshot of what people are experiencing at work. Although, interestingly enough, it'll be mostly unionized people. So we still have a lot of data to gather about, the working lives of precarious workers and some of the folks that are more vulnerable. But if it's this bad, and I'm going to say it's not good. If it's this bad for unionized workers, imagine what it is for people who don't have the protection of a union and who have very precarious jobs and who are vulnerable, on a variety of different grounds of discrimination. So lots of work to do.
Places. I think, Chris, you were talking a little bit in a talk we had earlier about burnout in the sector. The sector relies so much on the goodwill of people who put their hearts and souls into this kind of work, whether it's frontline or research or whatever. So can you talk a little bit about what you would think we're calling the feminist brain drain or the sense of burnout in the sector?
Absolutely. And thank you everyone for your comments about like a system level, need to like break down these systems of oppression. Like change needs to come at so many different levels, whether it's systems, individuals, our societies, our institutions, but looking at the systems that are reproducing oppression in our society is definitely a place to start. So I really appreciate this conversation and tying into that, we're looking at like our organization, the workers are, these are frontline shelter workers as well as managers. And what we're hearing from our provincial associations and the network itself is there's a high turnover happening right now, which some are describing as an actual crisis in having enough workers to do this work. We know it's a female dominated sector. We know from our work that we've done, such as the More Than a Bed report that came out a few years ago, how the salaries and wages are not adequate, how many of the shelters are not unionized because they're very small workplaces, for one thing. And we know that they're already struggling before the pandemic. So when you add that other layer of the crisis and the additional demands on the shelter staff to try to keep themselves safe, as well as the clients coming in, as well as the residents, and trying to meet the complex and ever-changing public health restrictions and demands, and just trying to adapt on the fly. We've heard within the last year, like even within our own internal database, of 25% turnover in our leadership in the sector, in EDs and management. So that's not even speaking to the frontline workers, which we know we're also losing. So something I've been having conversations with other researchers, as well as our network and our associations, around what is happening. And I am calling it a feminist brain drain, because we're losing our talent. We spend a lot of time training these workers to have trauma-informed feminist analysis, intersectional analysis, like cultural sensitivities, to actually be able to support folks in a very trauma-informed, safe way when they're trying to rebuild their lives. And we're losing them to other sectors. We also know we're losing them because many women have had to leave the workforce. And I'm sure Vicky can really speak to that in terms of what they're seeing at the national level of women leaving the workforce. So, we're really concerned about it, but like Dr. Ocampo was saying, like, we're also really thinking solution focused. And I really think it's important to get some of our sector together to talk about, how do we save these workers? How do we keep our talent? Because we are burning out. Like, we're tired and we're trying, and all the waves, and it's all coming at us. Like even our workplace, which is a small team of 5 people, we're feeling it too. And we're not even frontline, and we're just doing policy and research and support and making sure funds are getting out to shelters. So like, you can see that trickling effect. And I think when we think about these workers, they need our support, and they need attention as well, and their expertise. And we really saw that at the National Action Plan work we did with the expert working groups. And Vicky, I remember having conversations with you about it, and every single group across all 4 pillars said the workers, the frontline workers, are experts, and they're not being recognized, and they're not getting the proper adequate salaries they deserve, or the compensation they deserve to do this work. It's hard on the body, it's hard on the soul, it's hard on us to do this work, to try to end gender-based violence. I mean, that's why we're doing this work, right? So I think that, there's some really great recommendations in our National Action Plan roadmap that speak specifically to this, but it is something that's really come to our attention that we're hoping to do some work on in the new year, around bringing together some of these workers, talking about what's happening in our sector, not researching it. There's so many projects going on right now. And that's the other factor, is another pressure on our sector is we're tapped out of research, where we're just over-researched right now. It's important. We need to know what's happening. I'm a researcher in the sector too. I know that we need the data, but also we're also seeing like research fatigue. So it's like finding that balance, right? And keeping folks engaged and participating in this important research. We need to document what's happening so that we can push for the policy changes that Dr. Gotel and Vicky and Dr. Ocampo have been talking about, So yeah, I think that's a new area we need to be looking at a little closer.
I was just going to echo what Chris has been talking about. And, we have this pervasive social problem of gender-based violence and violence against women that has been longstanding. It's the rates are not going down. And yet, as a society, the approach that we've chosen to deal with it is to have largely women and gender diverse people working in the nonprofit sector bear this burden through their underpaid and unpaid work. And this is a problem that I think that has been acknowledged in other panels today, and that is the devaluation of care work. We have frontline experts who are the experts in this area. They're frequently highly trained, and they've developed years of expertise in dealing with violence against women. And yet we're paying them poverty wages, and they're willing to do this work for poverty wages because they're so deeply committed to ending this problem. This has to change. It really does have to change. I just also wanted to say, responding, Liz, to a question you asked a little while ago in terms of whether there's more awareness of the problem. There should be, but I think unfortunately in certain parts of the country, we're not seeing that. Like in Alberta, we saw a rise of very disturbing incidents of gendered Islamophobia, where women who wear the veil were being physically attacked, while walking around outside. But we haven't seen a political recognition of this problem. In fact, the solution offered by the Kenney government here in Alberta was to allow people to carry pepper spray. So this is not the kind of systemic response to these complicated problems that we need to see from our governments. But we do need governments to take responsibility for this pervasive problem.
What we're seeing is burnout in the sector.
I think I missed it. Was that question? I missed the beginning of that question, Liz.
Sorry, I was just going to ask if you wanted to add anything before we get to.
Yeah, well, I just want to add, I think it's really important to say this, that a lot of the policy and advocacy and government relations work is actually not funded. This is unpaid labor that our experts who are working in the nonprofit sector, who are working in GBV services and support do, because they know that systemic change is what is actually going to happen, but they're not funded to do that because of the way that the sector is funded. It's all projects, it's all oriented towards services, and it's so low that, they're not only are they getting sort of paid wages that are totally disproportionate to the value of the work, right? But they're doing all this other unpaid work in terms of advising governments, trying to make sure that GBV remains a political priority, doing public awareness, speaking to media, all of that is not funded. And so, that's contributing to the burnout, and it is not acceptable. It's got to change, right? And it has to be, if governments are really serious, then it really needs to address the underfunding of the sector.
Well, thank you. We're coming we're about 7 minutes away from the end of the panel, and I just wanted to get everybody's final thoughts on perhaps just some bright spots that you've seen and some ways forward that you think are going to be useful. I think we've all agreed here that, we can no longer respond to this crisis as a crisis and more as a chronic and interdependent series of, essentially failings that we've only papered over the years. So what has this period over the past, almost 2 years, showed you are the bright spots and possibly the way forward? And we'll go in a circle, but anybody feel free to just go first. Or I'll pick
Okay,
somebody.
I will. I have this great project of service providers working together from different sectors in Hamilton on kind of an alternative housing model to help women not become homeless, so to prevent homelessness when women are fleeing violence. It's a model that's present in other countries, but not Canada, and we need this model. It, usually when women are fleeing violence, they become homeless because they just leave home with, just the shirt on their back, and they take their kids, and then they go through this very chaotic cycle of trying to secure housing and all sorts of other things. But this model supports women to safely stay in their homes and removes the perpetrator from the home. And so through the pandemic, there's been, despite all of the burnout that everyone has mentioned here from in the sector, the service providers really want to advance that model. So we've really worked together to really try and put a model, design a Canada-made model of safe at home to try and prevent some of the homelessness and chaos that happens when women are trying to leave an abusive relationship. So in a way, we're working towards something positive rather than managing a crisis, although it is a crisis that they are managing when women flee. But it has been a really great working relationship, and we plan to continue.
Lise, would you like to go next?
Well, sure. I mean, the Alberta government today finally signed on to the federal childcare deal. That's something great and definitely related to the problem of gender-based violence, because as you know, we've been talking about, gender-based violence is related to economic insecurities. So improving access to affordable childcare is a huge step, I think, in terms of addressing some of the systemic causes of violence against women and gender-based violence.
Thank you. Vicky, would you like to address this?
Sure. I mean, to me, the two kind of, bright lights in terms of that are giving me hope. One is we do have consensus from all levels of government, at least from the ministers responsible for the status of women, to work towards a national action plan. And there is money in the federal budget, and we have an incredible basis to work from the work that was done with the expert group coordinated by Women's Shelters Canada. The other thing, and the thing that really gives me hope, is I just remember the moment that we negotiated ILO Convention 190 and being able to be there in Geneva at this moment where governments, workers, and employers all reached consensus on a strong document and a new human right that is comprehensive, that includes everybody in the world of work, all situations, that protects workers who are marginalized for various reasons. It was so elating, and that stays with me now, because I'm convinced that when we ratify it and we actually work to implement it, that we will be able to make a difference. And just today, the UK indicated that their intention to ratify. So Canada needs to be next. Let's make it happen.
Sure, these are all great, bright spots. They just make me feel warm and fuzzy. So thank you, everyone. I think what has been really great is just thinking about the sectors we work in and how folks are really having to think outside of the box, and how they're really, we have to do our work differently. And part of what's been really inspiring is all the collaborations that are happening that I'm so privileged to be a part of, and actually seeing academics and grassroots folks working together in different ways. I almost feel like we've had more opportunities to do that. I feel like I've been invited onto more research projects that I might not have been a part of in the past. So one project we're working on is on vicarious resilience of frontline workers. And I feel like that, to me, is such a bright spot, really flipping on its head the idea of burnout and compassion fatigue and vicarious trauma. We know those are real issues, but let's also see how folks gain their strength in this work. And I think about the people who work in our sector and how they give their bodies and their every day to do this work, and how I do this work to support them. They inspire me every day. So the fact that, looking at their work and not just seeing the negative, as Pat was mentioning in the beginning, looking at those positive aspects and what solutions can come from that, and looking at things differently is really important. So those are a few things that have been really inspiring to me. Right.
And so many interesting kind of paths forward to think about, but also I think everybody seems to agree on, what needs to be done, really. And it is a huge challenge, but I'm so inspired and really galvanized by the work that you all do. And I hugely appreciate it. And I hope that when we gather again, it will be post-pandemic. So I want to thank you all so much for your insights, your research, and your work in this incredibly important field. So thank you very much all. And thanks to the audience as well for listening.